talks, of course, were ended at the time of the government called the general election. But it's a 5-day strike. The timing of the strikes raised a lot of questions, given just a week before the election. Let's talk to Dr. Robert Lefever. He's a former NHS GP and joins us now. Good morning to you.
Good morning.
Thank you so much for joining us. Do you think the junior doctors they've got a right to go out on strike? Should they be going out on strike now, and particularly on strike now, just ahead of a general election, during the middle of a campaign?
The junior doctors of the British Medical Association are a political organisation. They have a right to do whatever they want. I personally would never strike. It's not something I believe any doctor could do. But, you know, the BMA is a trade union, and it will do what it wants to do, and then it will blame the government for not doing what it wants.
So, but you think going out on strike as a doctor, full stop, is unacceptable? Because we saw, you know, it was the nurses for the first time went out on strike in this last pay round, and that was the very first time the Royal College of Nurses had ever balloted strike. And even when they actually wanted to continue the strike in the leadership, the members said they voted no, we'll go back to work and we'll accept the offer, which is quite telling, isn't it?
It is very telling. When I was a member of the Inner London Local Medical Committee of the British Medical Association, I was told, we will listen to your ideas when you've been on this committee as long as we have. So
oh no, I don't think that's always a fair result. People can come with new ideas, but they're asking for 35%. They're saying they want to backdate to what their pay would have been back in 2008, I think, before we had austerity. There's no doubt at all, doctors, like lots of public sector workers, by the way, like lots of private sector workers, have actually seen their pay eroded over the years as inflation has been higher than the pay rises or pay cuts or pay freezes they've had. And certainly people have had their income massively eaten away by inflation in the last couple of years. What do you think would be a fair settlement for the junior doctors, bearing in mind, didn't the consultants get 15% or something close to that?
I think that this is a matter for the politicians to decide. The BMA has only one policy, and that is more pay for me. So
isn't that the job? Isn't that the job of a trade union?
It is, but I believe that doctors have a special position, and so do nurses. And the nurses, as you pointed out, did come round to saying, we will accept. That was the membership decision, whereas the BMA is being run by its own junior doctors political organisation. And I don't think that's right. Doctors should never strike. Nurses should never strike.
But if that's, but then how do they get what they would regard as a fair pay rise? I mean, the argument, I'm not in favour of them striking. I think they've got a right to do it. At the moment, you could argue they, like soldiers and police officers, shouldn't perhaps be able to strike because they're so crucial. But there's also an argument that lots of doctors and nurses are leaving and they're going abroad, but they can get paid more. Where if lots of people are not joining the profession because of the pay, they need to be paid more. I mean, that's how you attract better people in the private sector. If you can't get people, you can't get lorry drivers, you pay them more. You can't get trained, you pay them more. Shouldn't doctors be in the same situation?
I think the political party reform has really got some very interesting ideas on that. And the first one is that frontline NHS staff should pay no income tax for 3 years. Well, that's really something.
It isn't. Well, you know, again, they might find it a bit of a shock 3 years later, though. I have a funny feeling that when people arrange their finances around that, they might suddenly, you might end up, you're just delaying the problem by 3 years.
By that time, they should have been able to be sufficiently promoted to be earning more money anyway. The second belief that reform has put forward is that there should be 20% tax relief on all private healthcare and private insurance. So again, that's an interesting story. It's not privatising the NHS. It's simply saying...
making it cheaper. However, of course, we know often you can't see the NHS consultant until sort of, November. Oh, but he or she's got an appointment next Wednesday if you go private. It's the same it's the same people. Well, you're just kind of... I never think you're going off the NHS roles. No, you're contributing to the NHS roles by going private. I've got no issue with people going private. I've gone private. So I'm just saying... look, I appreciate you joining us. Dr. Robert Lefever, your former NHS GP. Other parties do have... you mentioned a couple of reform policies on this. Other parties, of course, do have policies to tackle this issue.